Hello, everybody, and welcome. This is Dr. Noel Crosby, audiologist and owner of Odd Bliss. What is Odd Bliss? Well, Odd Bliss has different legs to it. One of the legs is CBD oil called Odd Bliss, and the other leg is experts that are available on my site and locally that can provide you services to help relieve your tinnitus. And today I'm excited to have one of my local experts, Dr. Judy Hutch of Oro Valley Audiology in Tucson, Arizona. And she has been an audiologist or she's owned her private practice for 24 years. And today she's just going to tell you a little bit about what she does with tinnitus patients and why you would want to work with her if you live in Arizona. Welcome, Dr. Hutch.
Hi, thank you very much, Dr. Crosby. Tinnitus is just such a challenging part, and I see such a large military population, both active and vets. And, hearing loss and tinnitus are number one and number two on disability as they get out of the military. So I started to explore, what do we need to do? And we really have to work with the emotional reaction that we have to tinnitus. There's so many people who have it, and a small percentage of them just have such a negative reaction to it, and it just changes their lives. I had a 27-year-old yesterday who was in the Army for 8 years, and he just didn't even know how to deal with his anger that came out of it. So, the first step is finding all of the resources and then talking to them about how they can change their emotional reaction to
Right.
it. And so I'm glad to also have Odd Bliss as an option for them as well.
Yeah, like I know over the years that I've been an audiologist, like so many people just are so frustrated with their tinnitus and with the treatment that they've had surrounding it. Many times, without even doing very much, doctors have told them, oh, there's nothing you can do about it. You have to live with it. And also, there haven't been a lot of audiologists or other professionals that have really delved into it as thoroughly as you have over the years. And so there haven't been a lot of resources for local people. I mean, there might be somebody that's an expert in Arizona like you are, but somebody else may live in rural Arizona. So, and it may not be as easy to get to you. So one of the things that I'm excited about with the Odd Bliss program is that we will be able to set this up with, you will be able to work with somebody virtually who lives in Arizona for now anyways. That might get to be expanded later. But so tell me a little bit about how or what you would want to be able to relay to people who don't live close to you, but that you feel like you might be able to treat them. Would they have to come to your office? Would you find a local person to just do the basics, or how would that work?
Well, we just have to check what resources do they have in their community. And I am on the board for the Arizona Audiology Coalition, so we are able to reach out to other communities. But outside of Phoenix and Tucson, there's not a lot of resources. There's some in Sedona and some in Flagstaff, but outside of that, it's really hard to find tinnitus specialists. So we always want to have a hearing examination. And if we can't, we have to kind of work around that. But the audiogram tells us a little bit, but I would like to have expanded tests if at all possible. But we can start with questionnaires because the tinnitus handicap index, those types of things is where on the scale is the person, and that can give us an idea as well. What medications are they taking? We
Right.
can step through all of that. What health conditions? Are they diabetic? Are they working with their diabetes education specialist? And really just expanding and hopefully finding those resources in their area. There's some places that they take a trip to the big city, and we
Right.
can get them connected at that time too.
So you could do everything that you need to do in a day and then just do all the follow-up services virtually or remotely. Because even if it was somebody that had a hearing loss and you needed to adjust things, you might be able to do some of that remotely as well.
Yep,
So they wouldn't really have to be coming to your office all the time, but maybe
yep,
just that first initial if you couldn't find somebody locally to help them,
yep.
right? And so what other things, what other treatment, when you see a tinnitus patient, what are some of the other treatments that you might provide for them?
So we look into sound generators, whether it's a room sound generator or if it's an air level sound generator, because we do TRT, tinnitus retraining therapy, um, and then there's a program through the VA that we use as well, excuse me, that gives a lot of resources. So it's really finding, um, like we had talked about before, what are those little things to get us to the steps? Sometimes there's hyperacusis where the loudness of sound is bothersome. So we have to treat that before we get to the tinnitus. Um,
Okay.
and we've run into a lot of people who want to wear earplugs because they don't want any sound, and we have to work them out of that. And sometimes that's just listening, and people just need to feel heard through all of this, because you're right that our industry, our health industry, has for too long has said you just have to live with it. And that's never a good answer.
Right. Well, I'm excited to have my whole Odd Bliss concept and program getting started because that does happen so often. And I'm so excited to have an expert like you as part of it, willing to take that step to really try to reach more people that haven't been able to find a solution to things. Just to say a little bit about the Odd Bliss CBD is that we know we had talked in another video we did that it's really just part of the whole treatment program. So it's just one leg of it, and there'll be other legs as well. And so we're excited as we move forward how that's going to be built out. And, you know, I really want Odd Bliss to be a resource for people. So let's say they come and they see you locally, you might be able to provide everything you need to them. But there might be a component that you want to get an expert, like let's say maybe some type of stress relief. You wanted them to work with an expert on stress relief. Well, we'll also have an expert on our platform that specializes in that. So it will be a resource for audiologists as well as for their patients. So I'm really excited to get that all set up, and I have this big vision for it. So I just
Yes.
wanted to thank you very much for coming on today. Do you want to say any last words?
Just you brought up a great thing is paying attention to our breath. And I have used things that I've learned throughout the years because I have tinnitus and there are moments of stress. And you have helped quite a bit because I also use CBD, and it does help me in a variety of ways. So I like to have that option for our patients. And I'm very thankful that you have this vision. This vision.
Thank you, Dr. Hutch. So we will talk again later, but thanks everybody for listening, and we will see you another time. Thanks.